Hello everyone. I'm Miko Aguinaldo, and I'm going to be presenting my honors thesis research to y'all, which is titled Dentistry's Role in Antimicrobial Resistance, and it looks into dental prescription patterns and their impact on AMR. I want to start this presentation by introducing antimicrobial resistance, or AMR, and what it is. I think many of us here, we all know what microbes are, which are pathogens, bacteria, viruses, and we've developed antimicrobials which are used to combat these sort of microbes and help stop them from causing diseases and infections. But what if our antimicrobial drugs become sort of ineffective against these sort of microbes? That's the issue I want to talk about today, which is antimicrobial resistance. And that's a phenomenon where microbes become resistant to antimicrobial drugs. And as we can see in that diagram on the right, that's just sort of a process of how AMR can occur, in which we see that there's a plate of bacteria and we treat it with antibiotics, and the resistant pathogens, they're going to persist and they're going to then multiply, and then when we try to treat it again with antibiotics, it's going to have a harder time getting those resistant pathogens out. And so what happens when these pathogens become resistant? That leads to more persistent infections and increased health risks. And basically, as we can see from the diagram, every time we treat bacteria with antibiotics, we give it a chance to mutate and adapt and become resistant to that. So that's why we need to make sure and see how the misuse of antibiotics can ultimately lead and boost the development of AMR. So how prevalent is AMR? I provided this diagram here, which looks into 23 common resistant bacteria seen, and common bacteria that cause infections. And by this bar graph from the light purple and the dark bar, we see the dark bar shows how many global deaths can be directly attributed to AMR, and while the light purple bar shows how many deaths can be associated or linked to AMR. And we see that directly, almost 1.27 million global deaths annually occur directly from AMR, while almost 5 million deaths annually occur that are associated with AMR. So that just shows that AMR has a big global presence and is a big global issue. I also want to touch on some current AMR trends. Everyone knows about COVID, and we saw during 2020 after COVID, AMR saw a big increase within its burden. And this is a table given by the CDC where they highlighted 7 common resistant pathogens found in hospital clinical settings. And they saw that in 2020, there was a big increase in the burden of infections from these AMR, from these resistant bacteria. And so just year by year, they tracked and just sort of monitored if this increase was starting to come back down or sort of stabilize. But in the latest data given in 2022, we see that these rates of high increase still remain from pre-pandemic levels. I also touched in my introduction about how the misuse of antibiotics can boost AMR, and that's given in this graph here. And this is a study done in Europe using 19 countries, and we see here in this graph on the bottom, we see outpatient use of penicillins, and so penicillin is a treatment used typically against, as we see, S. pneumoniae. And we see in the bottom, as you use more penicillin, we see on the y-axis that talks about penicillin non-receptible S. pneumoniae, which are basically resistant S. pneumoniae, or the percentage of the S. pneumoniae that are resistant to penicillin, it increases. So we ultimately, in this study, they found a positive relationship that the more you use antibiotics, the higher resistance occurs within those bacteria. And so now that I've given y'all that introduction on what AMR is, I wanted to tie it into something that something I'm interested, which is dentistry, as I want to become a dentist. So I kind of looked and saw how AMR is playing a role within dentistry of today. And so I'm going to go over dental antibiotic prescription misuse, prescription patterns, and antimicrobial stewardship. So first, dental antibiotic prescription misuse. This is what I have found to be the leading problem and leading cause of AMR within dentistry. And so in dentistry, they prescribe antibiotics for dental infections, but most commonly they use prophylactic antibiotics, which are kind of preventative antibiotics, which they give before they perform procedures, and they are usually used to give those to high risk patients to prevent further and worse infection after that procedure. And so I also found that almost 5 to 10 of the global antibiotics prescribed are from dentists. And so I wanted to look into certain prescription patterns and the world of dentistry to see how studies have shown that there's an overuse and misuse of these prescribed antibiotics by dentists. So now I'm going to go into some data showing the dental prescription patterns. And so here, this is this first study done in British Columbia, and this tracks just the total antibiotic prescription from different disciplines, whether that be physicians or surgeons or dentists. As we can see on the bottom, this is just tracking from 1996 to 2013. And then on the y-axis, we showed a defined daily dose, which shows how much antibiotics are being prescribed and used. And as we can see in this graph, there's an obvious difference from that blue graph, which shows the British Columbian physicians and surgeons, where they're honestly, they show a decrease in their prescription of antibiotics. But here in the green graph, we see that there is a steady and consistent increase of total antibiotic prescriptions by dentists. So that just shows, maybe indicates overuse and shows a gap between when it comes to dentistry. Another study here, this is a retrospective cohort study that looked at over 91,000 patients. And they subdivided it into US regions and also overall average. And this study just looks into how many antibiotic prophylaxis within dentistry was unnecessary. And as y'all can see from this graph, it's a big bar, and it's almost 80% of antibiotic prophylaxis prescriptions were unnecessary, which means that almost only 20% of those patients that were prescribed those antibiotics were of those high risk, or the ones that actually needed those antibiotics. So this just highlights the significant misuse of antibiotics within dentistry. And lastly, I want to talk about antimicrobial stewardship, because I wanted to, one, locate the problem and the issue, but also see how, if there's any initiatives starting to try to combat this problem. And what I found was antimicrobial stewardship. And that is just kind of the promotion of responsible management and a coordinated approach to promoting appropriate prescriptions. And antimicrobial stewardship is honestly a big and growing sort of solution to attacking AMR, and a lot of research has shown a lot of promise to combating AMR. So I'm going to go into one study, which is a new study, and it's still a pilot intervention study, and this was done by TO and other researchers. And in this experiment, they recruited 26 dentists for a 12-week study, where in the first 6 weeks, these dentists, they recorded their prescription patterns, and then at week 6, they stopped. Well, they started an intervention where they were provided an educational prescribing website where they were taught about appropriate prescriptions and using it the right way. And then they tracked that data the next 6 weeks after that intervention. And then they compared those two time periods to see if there was any changes. And there was. So in this first table, I know it's a lot, but this is showing how many, this just compares what prescriptions were appropriate. And we saw that before the intervention, there was 130 inappropriate prescriptions. Then after, there was 72, which means there was almost a 45% decrease in inappropriate prescribing, which shows a lot of promise in a lot of growth within appropriately prescribing. And then also, what's also important is not just misusing it, but overusing it. And so we saw in this next table, this showed how many of the total antibiotics are even being prescribed. And we saw that also decreased by almost 40%. So just to conclude my research, we see that AMR is a big global issue, and also by looking into the dental prescription patterns and the data, we see that dentistry has a lot of gaps within AMR. And that just those gaps show like a highlight of a need for change within dentistry and becoming more consistent. And so, as we could see from that last section I showed, we see that incorporating antibiotic stewardship programs and educational initiatives are showing promise and opportunities in protecting patients and preserving antibiotic effectiveness. And so I just want to hit home the fact that antibiotics, they are very important to us, and they are used wherever, whether that's a hospital, a dental clinic, or a farm, but however it's used in one area can affect how it's used in another area. So everyone involved in antibiotics needs to be responsible stewards so they could protect the efficacy of these drugs and also protect patients of today and tomorrow. Thank you.
We have time for some questions. Questions from
Dr. Goldie.
So I'm wondering if there's any data on thinking about the idea of like which prescriptions are inappropriate, right?
Mhm.
And if dentists were to stop prescribing prophylactically unless patients are high risk, is there any data on then what percentage of those patients would actually get an infection and have to get an antibiotic? I'm just wondering if it's like a really small percentage and if that.
So like you're talking about like the further, like after, like if the test after?
Yeah, like is there any true consequence to if the dentists aren't prescribing prophylactically? Like is there any downside to them not doing that?
Yeah, so I think the biggest issue we've seen that a lot of it was unnecessary. So like it's more of just like over prescribing is more of the issue than under prescribing. So like I definitely see like how if we did back off, there could be cases where like that was needed, but in this case, we saw in that one data, almost 80% was unnecessary in some cases. So yeah.
And how do they determine it's unnecessary? Like,
So unnecessary is when it should be given to mostly like those high-risk patients. And so in dentistry, a lot of that are people with heart defects or heart conditions. That's because when you have like cleanings and dental procedures, that bacteria can get in the bloodstream. And so the reason they are giving those antibiotics to those high-risk patients are to prevent like heart problems like endocarditis within the heart, yeah.
That's actually fascinating. You just cleared something up because my mom has mitral valve prolapse and she always has to tell the dentist, and I never understood what the connection was between the teeth and the heart, and now I kind of get it. So that's interesting.
Yes, sir.
How's it going? How are you listening?
Going good, going good.
I just wanted to say, man, you did an amazing job, and I'm so proud of you.
Thank you. Dr. Gary.
Yeah, so can you go back to the chart that shows the year-over-year differences? That one.
Oh.
That one, the table, sorry. So what was it about COVID that caused this, or would you seen this anyway?
Yeah.
Just because over the years it's increasing? Or was there something specific about the pandemic?
Yeah, so I looked into this. I was asking that same question. I'm like, so why would COVID cause an increase in AMR? And I found that for one, they were like false prescribing because like when someone comes in and it's like feeling sick, sometimes they're just prescribing antibiotics when COVID's a viral sort of infection. And so there was that. And then also during the pandemic, there was a lot less surveillance and monitoring of AMR. So a lot of things that would be caught a lot earlier, they were kind of going under the radar. And so that was probably what was causing a lot of that AMR to be more at an alarming rate.
It looks like a lot of them get better in 2022. So is that just...
That's a 2022 compared to 2021.
Right, so
Yeah.
it seems like in that year...
It's starting to stabilize.
Starting to go back in the right direction.
Yeah, it's starting to stabilize.
Is that education, or is that just there's not as many people going in and saying, I have COVID, give me something, or...
Yeah, I think it's one, the less overwhelmed hospitals and less like overwhelmed systems and stuff like that. But yeah.
Well, but so we're at least doing better than this one. Another question?
I'm sure it's like super like complex, so just give you this stupid guy answer. But like, what could you go if this is not your topic? Apologies. Like the mechanism for like antimicrobial resistance. Like I understand you got like an antibiotic or whatever it might be. Like, is it just it escaping like the antibiotic like, escaping out into the wild, where it's introduced to like the bacteria that it normally wouldn't be? Like the overprescription, is it getting out there? Like how is like the resistance like spring up? Like how is it introduced? Like,
Yeah, so resistance is sort of like a natural phenomenon.
Okay.
And then, like it's just kind of by luck in a way where a pathogen will just mutate to be resistant to that.
Yeah.
And so our job is to just sort of just prevent and slow that process by being as like efficient as we can. So we don't want to overprescribe treatment, which gives bacteria an extra opportunity to mutate and adapt and become resistant to those sort of drugs that we are typically using to treat those pathogens.
Gotcha. So if you gave it to like a help like unnecessary cases, right? Like I guess what my question is like how does it like is it the antibiotic is like encountering bacteria? Because if it's an unnecessary case, we wouldn't have the bacteria to encounter it. If I'm getting that right, is it just like you expel it out in like sewage, or like you dispose of the antibiotic improperly that it's like encountering the bacteria to make it resistant? My apologies if I'm asking this still.
No, so like it's not like you're giving the wrong antibiotic, it's that you're giving it when it's not really necessary.
Yeah.
And so you're, in a way, by giving it when it's unnecessary, you're accelerating a process that could be prevented by just not prescribing that at all when it's not needed.
I was wondering, what's like the most like enjoyable part or interesting part of like your entire research process?
I think I enjoyed a lot just kind of picking something, because like the honors program, they gave us full reign to just pick whatever you're interested in. And so I like being able to have something already learned here on campus, which was antimicrobial resistance with Dr. Edwards, actually. And then I wanted to tie it into something outside of school that I'm trying to venture into, which is dentistry. So I was trying to just mix of those two, and allowing myself to like kind of immerse myself within dentistry right now and see like what's the current conversations going on within the community and stuff like that.
This is kind of a clarification of this question. But so my assumption is that the reason antibiotic resistance is an important consequence of misuse and misprescription is not because there's bacteria on your teeth that are becoming resistant, but it's because everyone has Staphylococcus aureus on them all the time, and a bunch of other bacteria on them all the time. What bacteria are typically associated with like dental infections? Like what are the bacteria that we're worried about? Not the ones that are becoming antibiotic resistant, but the ones they're prescribing it for in the first place. Like, are there specific ones that are on your teeth that you need to stress out about?
So that I don't know, like the specifics, but I know that within dentistry, they're not as specific. So like they use a lot of broad spectrum antibiotics like amoxicillin, and so that's kind of just shows how like they're not really specifically targeting like specific bacteria. They're more just kind of giving like a broad spectrum antibiotic, just hoping like whatever bacteria is in there just doesn't persist into bigger infections.
All right, let's thank Miko. His mentor an opportunity to present him with his stole and his cords that he'll get to wear as an honor student during graduation, and to say a few words about that.
Yeah, so you probably know Miko, and that might be why you're here, or maybe you're interested in the topic. But if you don't know Miko well, I'll say he took epidemiology with me in fall, and he did a project on dentistry and epidemiology, and then he continued on to look at AMR in dentistry. I think I'm one of those people who doesn't like to go to the dentist. But I will say that I think he'll make an amazing dentist, because whenever Miko walks in the room, you just feel the temperature lower. He just has that relaxing personality that will put people at ease and make them less worried about anything that happens. What do you think? Yeah. So once you're a dentist, I would definitely.
Sounds good.
Congratulations.